and welcome to World Insight, our special edition, The Turning Point, China's Rebound and Global Recovery. I'm Tian Wei. In the face of multiple COVID waves, China announced it has managed to contain the worst of the pandemic. It has also kept the economy growing at an average of 4.5% over the past 3 years. How to look at China's practices and its way forward? For deeper insights, let's have our panelists. I'm glad to be joined by Alice Tan, who is an internist at the Medi Women's Hospital in Seoul. Also, Professor Hu Na-jun, who is an associate professor in the School of Public Policy and Management from the University of Chinese Academy of Sciences. Welcome to both of you. Now, as China has been adjusting its policy toward COVID-19, how do you see it is going to lay a foundation for the normal social and economic life in this country and hopefully China's interaction with the rest of the world? Dr. Tan, please.
Well, I think in not just China, but around the world, we're now trying to figure out how to transition out of an emergency phase to an endemic phase and living with this virus. And it was very telling last night. So on the 26th of January in the US, the US FDA had their vaccines and related biological products advisory committee meeting discussing what to do about vaccinations in the both near future and in the upcoming years vis-a-vis COVID-19. And one very well-established, I think, thought was that this continues to be an evolving virus, and it's not going away anytime soon. And so we do need to have a long-term plan in terms of how to live with this virus. And vaccination remains very critical because we still know from the data that vaccination decreases your chances of severe disease and death significantly, 13-fold, 16-fold, depending on if you're comparing with people who had 3 doses versus people who are unvaccinated. And so it remains very important to push for vaccination among the unvaccinated. This is in every country around the world. And also to come up with a strategy in the upcoming months to years for how to best protect our public against this virus, which will not go away in the near future and which continues to evolve.
To live with COVID, how to? That's probably the biggest question now. For China too, at this moment, Professor, as you may know, China is celebrating the Spring Festival, the Lunar New Year, together with many other Asian countries, including South Korea, where Dr. Tan comes from. But during this time, people travel and in a massive way. So there were concerns earlier about a new wave or a small wave as a result of this. But so far, it seems things are still okay, even though we haven't finished that Spring Festival travel rush. People are on their way back to the cities where they work now. So how do you see the current situation, Professor, and also about the realities of to live with COVID-19 for China now?
Yes, during the Spring Festival, it is quite clear that the new policies, the new measures has taken place. However, I agree with Dr. Tan that we must keep it in mind that the virus is still there. What have been changed is only the policy and the measures, but the virus is still there. So I think so many people, in my opinion, are still wearing masks. It's a good thing to see our consumptions are back, our tertiary sector are back, but we must also demand.
It's certainly wonderful to see Professor of Public Policy getting very excited about how things have been evolving so far. So far, so good. But Dr. Tan, same question to you, since you are the medical side of expert in this conversation. No authoritative, no official figures have been provided so far about how the Omicron situation has been evolving in China since the last big outbreak at the end of 2022. However, the Spring Festival travel rush, as we've seen in Asian economies, certainly would bring more interactions among different groups of people, especially the vulnerables. So how do you see the prospect that of short-term China living with COVID-19, with the virus at this point?
Just to let you know what's happened in other countries when, I'd say, a new variant such as XBB 1.5 is first detected, it can take anywhere from 4 to 8 weeks for the introduction of a new variant to manifest as a visible surge. So
you mean subvariant or variant?
Subvariant. So XBB 1.5 is a new recombinant variant of 2 different Omicron strains. And in the past, this happened with Delta, this happened with Omicron in South Korea. We knew that the variant had come into our borders, and we were monitoring the situation very carefully, but it took several weeks, from 4 to 6 weeks, for 1 case to turn into 2 cases to 4 cases, and then finally into a surge. So I think it's still a little bit early to assess the situation in terms of virus epidemiology, what's going on in China, especially with the spring holiday travel. So this is why close monitoring, testing, surveillance is still very, very important. Going back to your first question, how are we going to live with this virus going forward? It's going to be about individual responsibility, awareness about what is my risk for severe disease, awareness about what is the risk in the community right now. Is it a high level of transmission or a low level of transmission? Awareness about the risk in specific environments. Having awareness of this, kind of like knowing what the weather is day to day, I think that's going to be very important in the short term. And then also, to inform our public, we need epidemiological surveillance data, and this should be made public so that people are aware.
On the other hand, Dr. Tan, you know very well there is a phenomenon called fatigue, COVID fatigue all over the world. People have been dealing with the COVID-19 together with the policies of their economies, and also people have been informed and sometimes ill-informed, and which also strengthening in a way the fatigue as we have seen. So how to make sure at this point sufficient information is provided to the public while the science and medical communities are also trying to learn what's going on?
Right. So I agree with you. The COVID fatigue is real. We don't want COVID fatigue to turn into COVID regret, right? So we don't want people who are high risk of severe disease and death to think that it's okay for them to go into a high risk situation and have that moment of freedom and relaxation and fun turn into regret. And so that's why informing individuals and communities is so important, so that people can make the right choices. We can't live in a situation that is such high stress and high level of isolation and a sense of danger all the time. It's not good for our mental health, and it's not necessary at this point in the pandemic. We have vaccines that work very well. We have treatments. We have many tools that can be accessed so that we can enjoy our lives again. But we want to make sure that people who are at the highest risk know how to protect themselves and don't make decisions that can turn a decision from fatigue to regret. We just don't want that to happen. We don't want people to make dangerous choices.
Yeah. In China, during the Spring Festival, you will see in social media, for example, Professor Hu, that some of the elderly generations, particularly in rural areas, as a result of the scarcely located their housing, have not been infected with COVID-19 yet. And so the children, the grandchildren, and even the great-grandchildren of the elderly generation would try to pray to them and also show their respect to the elderly from outside the window, from outside the building where the elderly generations are living. So we saw a lot of those things. People would kowtowing to their mother and their father who are aged already from outside the window just to protect them. How do you see awareness like this in China? How well protected are the elderly generations in China right now in terms of vaccine and other measures?
Well, generally speaking, we must protect the vulnerable people, not only in our society, but also in our family. As you have mentioned, the situation is quite special, but I think we should also talk about this topic in details. For example, in this Spring Festival, I went back to a rural area in Beijing. It's near the border of the Beijing and Tianjin and Hebei province. But this village, I saw this, according to their information, nearly 70% of the total people in these villages have been infected. So in this village, we see a quite normal life. People will go to their relatives, go to their friends, families to say Happy New Year as normal as possible. There is no such fears or such fatigues as we have discussed before. But I think in other rural areas, for example, my friend went to his hometown in Sichuan province, a rural area, the infection rate is very low. So they have to be cautious. They have to wear masks to see their elder relatives in their hometown. So I think this situation, just the same situation as China's economic situation. We have a diversified national situations in different regions, in different provinces. So I think right now what we need to protect is the most vulnerable region, not only people, but the region. And I think in our healthcare systems, we must locate our resources and the personnel downwards to the grassroots. That is what we have discussed for so many times. We do not have the hierarchy healthcare system, but right now we need something like this. We need GPs, we need some healthcare services in village levels.
Dr. Alice King-Tan, Professor Hu Nai Ren, thank you so much for both of you for joining us. Appreciate it.
Thank you.